Well, first of all, I want to thank the organizers for inviting me because I wouldn't have come here if I hadn't been invited, in that I am not someone who works in this field. But it's been a great day and a half, and I have learned so much. But one of the things that keeps coming back to me during all of the different presentations is how complex the aging process is. It isn't something that starts when you turn 50 or 70 or 90. It's, as I said, it starts in utero. It's a lifelong process. And so if we want healthy aging to occur, we need to start thinking about it from the very beginning. And we don't all age the same way. That's become very clear from the presentations that have taken place here. We age differently. Some age faster than others. It's a very complex, diverse process. So how do we intervene in order to help people from all socioeconomic groups improve their way of aging? And I think that is something that we really need to keep in mind. We talk about improving social contacts or cognitive function, but I work in the poorest part of Oakland, California, and there are a lot of elderly people there that just don't have the resources to begin that process. So recommendations we make need to be recommendations that can be used by everyone. So what I would like to see us think about is, well, first of all, this has been a meeting primarily of nutritionists. And definitely nutrition plays a role in the aging process. But we've also learned here that many, many other disciplines are involved in as well. And so I think it's critical that we address this issue in a multidisciplinary way, not just through food alone, but also bringing in our friends from other disciplines. And I would like to see us start thinking about some key targets that are simple and easy to comprehend that we can tell the public to try to achieve in order to maintain their health. I think that if we could think of some functional outcomes that we would like to focus on, that would be great. Yesterday, when we discussed that briefly, it was suggested that trying to maintain a certain walking gait would be important for the aging process. Now, that's something that I think almost everyone could understand. You know, I need to go out and I need to be able to walk a mile in 15 minutes. I can get that. I think most everybody could. And maybe that could be a target that we could recommend. I'm sure there's others that we could come up with as well. I was trying to think of one thing we could recommend that would make it easier for people to understand what they should be eating in order to age healthy. That's pretty difficult because it's not just one thing. We've talked a lot about fruits and vegetables and increasing the intake of fruits and vegetables, but as I listened to the talks yesterday, I began to think we really need to go back and look very critically at our nutrient recommendations. You know, we stopped making dietary reference intakes after age 51. I think we better start thinking about having a category of 51 to 70 and then 71 plus, and look at the nutrient requirements in those different periods, and then translate them into food patterns and see if we can come up with something simple. I don't even think my plate is simple enough. It has to be really targeted and straightforward. Maybe it's something as simple as making sure you have a good source of protein once a day. That would carry a lot of micronutrients along with it. And we're beginning to think that protein needs may be higher as you get older. And we also know that elderly tend to reduce their protein intakes naturally. So maybe that should be the target for diet. So I would like to see us think about coming up with some specific recommendations, such as the physical activities group have said, you know, do moderate exercise at least 30 minutes a day. let's do something specifically for the elderly that they could all endorse and follow going forward. I think that's everything I have to say.
Thank you, right on time. Thank you so much.